Now I'm going to tell you about tuberculosis. If you read and listen this video, you can manage and prevent tuberculosis. Now we discuss some description about tuberculosis. This infection is caused by two similar mycobacteria. It is Mycobacterium tuberculosis and Mycobacterium bovis. Human are the main host of tuberculosis. Two types of tuberculosis. First, primary tuberculosis. Second, secondary tuberculosis. Now we discuss about primary tuberculosis. When microbes are inhaled, they colonize a lung bronchiole, usually towards the apex of the lung. There may be no evidence of clinical disease during the initial stage of non-specific inflammation. Cell-mediated T-lymphocytes respond to the microbes and the individual becomes sensitized. Surround the microbes at the site of infection, forming tuberculosis. These walled-off tuberculosis shelter microbes from normal body defenses. Some macrophages containing live microbes are spread in lymph and infect hilly lymph nodes. Primary complexes are formed, consisting of tubercles plus infected hilly lymph nodes. Necrosis may reduce the core of foci to a cheese-like substance consisting of dead macrophages, dead lung tissue, and live and dead microbes. Primary tuberculosis is usually asymptomatic. Do you know about outcomes of primary tuberculosis? The disease may be permanently arrested, foci becoming fibrosed and calcified. Microbes may survive in the foci and become the source of secondary infection months or years later. This disease may spread through the lung, forming multiple small foci to the respiratory passages, causing bronchiectasis. Now we tell you about signs and symptoms of primary tuberculosis. First, weight loss. Second, malaise. Third, night sweats. 4. Chronic cough. 5. Hemoptysis, maybe. Then, we study about secondary tuberculosis. This occurs only in people carrying a primary lesion, usually in the apex of one or both lungs. It may be caused by a new infection, or by reactivation of infection by microbes surviving within GAM foci, often following reduction of immunity by age or illness. As sensitization has already occurred, lymphocytes stimulate an immediate immune reaction. The subsequent course of the disease is variable. The infection may remain localized in the lung, with complete healing, or persistence of live bacteria with their sealed pockets of infection. Progress sign destruction of lung tissue leads to cavitation, pleurasy, pleural effusions and emphysema. Now we look at world epidemic status. Do you know about common sign and symptoms of tuberculosis? First, productive cough more than 2 weeks. Second, sudden weight loss. Third, evening pyrexia. 4. Night sweats. 5. Fever. You must know about diagnostic tests for tuberculosis. First, chest X-ray. Second, FBC. Third, ESR. 4. AFB, acid fast bacilli. 4. Spot sputum sample. Early morning sputum sample. Second, spot sputum sample. You should know what are the treatment for tuberculosis. For new tuberculosis patient, isoniazid, H. Rifampicin, R. Pyrazinamide, Z. Ethanbutyl, E. Streptomycin, S. Treatment for treatment failure patients. First and second months, H. R. Z. E. S. Third month, H. R. Z. E. 4, 5, 6, 7, 8 months, H. R. E. Thank you for watching this video. If you interested this channel, subscribe this channel. If you have problems and any suggestions, please comment. Thank you. Hope to meet next video.